Yes, ma'am.
So now the causes of fatty degeneration. What are the causes of fatty degeneration? Now in case of anemia, in case of cardiac failure, then the respiratory diseases, then diabetes mellitus, or chronic malnutrition. It may occur in the conditions like chronic malnutrition. Okay. Now, in the normal non-fatty tissues, that is in the intracellular fat, it is not or never visualized or visible by the light microscope. By using conventional fat stains, we could not get this fat. Intracellular fat is never get visible either by the microscope by using the stains. In fatty changes, the accumulated fat, it become visualized using the frozen sections and fat soluble dyes. Okay, so whenever this fat get abnormally accumulated inside the cell, it will become visualized. Okay, so it indicates that the fat, it is dissolved fat and is indicated by the clear vacuoles. That is, for the example, in the liver, this increased deposited fat, it causes enlargement of that organ, and it causes, that is, there are two things associated with this fatty deposition of liver, that is in the hepatocytes. The first is due to lack of oxygen, that is in the anemia, and it may happens in the cardiac failure. Okay, so here in that conditions, the fat, it tends to be deposited, that is from the arterial blood supply, that is hepatic arteriole, around the efferent veins, that is hepatic venules. Okay, it get deposited around the hepatic arterioles and the hepatic venules in the conditions like anemia and cardiac failure. And in the whenever this if the cause is poisons or toxins like alcohol or infections, that is hepatitis. Okay, it is the viral hepatitis or organic solvents. In that condition, the fat is found nearest to the this particular, we call it as portal triad. It get nearest to the portal triad or nearest to the afferent blood supply, that is portal venules and hepatic arteriole. Okay, so whenever there is lack of oxygen, this fat, it get deposited near the nucleus, near the center of the lobule. It get deposited near the center of the lobule. Okay, that is, it get deposited far away from this hepatic arteriole and the hepatic veins. But in case of poisons and toxins, this fat get deposited near the suppliers, that is, it is near to the portal triad, that is away from the center. Okay, so here there is difference between fatty degeneration. It is depend whenever this how this fat get deposited and where this fat get deposited, it is depending upon the disease condition. In anemia and cardiac failure, it is this fat get deposited away from the blood suppliers, that is hepatic arteriole and the efferent veins. Okay, but here in the case of poisons and toxins, it get deposited away from the center. Now, we will discuss what exactly happens in the fatty degeneration. Okay. This fat or the degeneration, it refers to the abnormal accumulation of the stenable fat within the previously injured or distended or diseased parenchymal cell. Okay, either these parenchymal cells, they are previously injured or they are deceased or they get inflamed in that parenchymal cells. This fat, abnormal fat, get deposited. Okay, now this fat accumulates in the liver in the various ways. The first cause of this fat accumulation is absence of lipotrophic factor in the food. That is, whenever there is malnutrition, in that condition, this lipotrophic factor, that is choline and methionine, these are the two lipotrophic factors. They are essential for the conversion of fat, that is neutral fat, into the phospholipid proteins. So for this conversion, these lipotrophic factors, they are essential, that is choline and methionine. So in the conditions like malnutrition, there is absence of lipotrophic factor in the food. It is one of the cause. The second cause is in the case of high fat and low protein diet. The third condition is after pancreectomy or by administration of anterior pituitary extract. So please write down these causes of this fat accumulation, by which ways the fat get either accumulate in the center of the lobule or at the periphery of the lobule, depending upon the disease process. Okay. So then the next cause is administration of the toxic substance like chloroform or carbon tetrachloride, alcohol. In that toxic conditions, this fat get accumulated, neutral fat get accumulated inside the hepatocyte. Now, the phospholipid formation, which is the essential part or essential for transport of fat from liver to the other organs or other tissues, for which the choline, which is helps in the formation of phospholipid. This choline, it is a lipotrophic factor. It helps in formation of the phospholipids. So what is the normal metabolism of the fat? How this fat get metabolized normally? This neutral fat, it will brought from the fat depots, it brought to the liver. Then with the help of oxygen, this the food contains lipotrophic factor, that is choline and methionine. This phospholipid protein complex formation occurs. That is, that fat with the help of oxygen or in the presence of oxygen and in the presence of lipotrophic factor, there is formation of phospholipid protein complex. So this phospholipid protein complex, it get carried towards the blood, that is phospholipid, for utilization in the tissues and for the storage formation. So it get carried out from the liver. It should not get stored inside the liver, this phospholipid form. Whenever this neutral fat get transferred into phospholipid form, it should get carried away from the liver by the blood vessels. Okay. So this fatty changes in the liver, sometimes it may be due to some hepatotoxic agents, okay, like viruses or bacteria, or chemicals, that is chloroform, carbon tetrachloride, phosphorus, or alcohol, or in the conditions like bacterial infections like diphtheria or viral infections, that hepatitis A, hepatitis B. In that particular conditions, bacterial or viral conditions, this normal metabolism of the fat, it will get disturbed. Okay. Then the metabolic conditions like toxemias of pregnancy, that is eclampsia of pregnancy. Then lack of oxygen in the conditions like anemia, or the anoxia in the conditions like CCF, congestive cardiac failure. And the lack of lipotrophic factor. So these are the all conditions, they are related with this accumulation of the fat inside the liver. Okay. Any queries about this part? Yes. Yes. Any queries related to this part? No, I think you have next lecture, no? FMT lecture is there. So I am closing this meeting.
Yes, ma'am.
We will talk tomorrow, okay? About remaining topic, that is fatty degeneration we will complete, then we will go for fatty infiltration, and then the next part of degeneration, okay? Yeah,